I just want to thank you for joining us today. We have a fantastic program. Couple things: we ask that you would mute yourself, and if you wouldn't mind, make sure you have your name with your picture so we know who's on. We have lots of information to cover, so please use the chat to do two things. One, feel free to put any upcoming events you think could benefit the members with contact information. And two, we know you'll have questions regarding both of the presentations. So if you'd submit those in the chat, we'll try to get to as many of those as possible. And now I have the privilege of getting to introduce our first set of speakers. We have Annette Jacobi, who has been the Executive Director of the Oklahoma Commission on Children and Youth since 2017. Previously, she served with the Oklahoma State Department of Health and with the Oklahoma Institute for Child Advocacy. Annette is also on the executive committee of the Count Me In for Kids. Then we have Joe Dorman as well, and he served as the CEO of the Oklahoma Institute for Child Advocacy since 2016. Prior to that, he served as the CEO of the House District Institute for Child Advocacy for 12 years and was a 2014 Democratic nominee for governor. We also have with us Dr. Laura Boyd, who will be moderating questions for both of our presentations. She is a national foster care authority, a public policy specialist, former legislator and gubernatorial candidate, president and CEO of Policy and Performance Consultants, and she is also a Count Me In for Kids executive committee member. Now, let us move on to our program and welcome Annette and Joe as they share an update on how Oklahoma's children are doing.
Well, thank you. I am very excited to be with you today, and I really am doing more of a setup so that Joe and everyone else can talk about perhaps what's on the horizon for policy, legislation, and practice for the upcoming year. If it's possible, I'm gonna, Steve, you wanna see if we can do screen share? Okay, so we're gonna attempt this. Let me find my PowerPoint. Here's what I want to start off with, and this is debatable, guys. The child who's not embraced by the village will burn it down to feel its warmth. I'm going to start with that. It's an African proverb because it's debatable on whether Oklahoma is on fire. And when we're going to go over some of this data, you can come to your own conclusion. But if we are on fire, folks, we don't have enough fire hoses, and that's part of our problem. There's a lot we can do to prevent this situation, and we really need to think about what do families and children need to feel secure and feel like they are being taken care of. Because if we don't support folks in raising their families and their children, then eventually this is kind of what happens. When people get frustrated and feel like they have not been heard, then we go to extreme lengths, right? And so let's go over some data and let's talk about what we know about Oklahoma. I want to do a little caveat here. The data I'm going to share with you is going to be focused around kids count data, and the most complete set that I could find for Oklahoma was 2018. But we would be foolish to think that the numbers that we're going to see are probably going to be perfectly in line with 2020. Will they vary much from it? I doubt it, but we do know that the pandemic has had some extreme effects on our resources and our services and what's going on in the state of Oklahoma. And I think we need to be cognizant of that. First and foremost, it has had a huge effect on abuse and neglect situations. And I want to, when we get done here, I'm going to send to Janine both the kids count data fact sheet where I pulled the data so that everyone can have this, and a couple different articles, one in particular coming out of the University of Chicago, Chapin Hall, and there are others, they're reporting something similar. We were super worried at the beginning of the pandemic and in the middle because we were seeing less reports of abuse and neglect across our country and in Oklahoma. And we were fearful that there were just things going unnoticed, right? And what we're now beginning to believe, because of good work like at Chapin Hall and other places, is that, and I've heard some people say, well, it's just that things are being over-reported in the past. That's not true. What is being reported is neglect. And we need to really help folks understand that child welfare spends the majority of their time, 70 to 80%, on neglect issues, which are tied to economics. And that's what we're missing. Those calls that we didn't get were because teachers didn't see kids in inappropriate clothing. They didn't see hungry kids, tired kids. But we're still getting calls. What we do think, though, is that the real severe physical cases that still showed up in ERs and were still attended to by healthcare professionals, those may have gone up. So we'll see in the end what this looks like. But I think what we're going to see is that economics really hit our families hard, and those cases were not being reported. We also know that we need, in Oklahoma and across this country, more dedication and time for preventative efforts. Our families were struggling economically, and we didn't have anything locally to hurry and quickly support them. We also noticed huge disparities in rural versus urban landscapes. Just think about the challenges that kids had to be able to do virtual learning when they didn't have good broadband. I mean, something that basic. We also had, obviously, the affluent versus the poor, the kids who already had laptops and fancy stuff at home and they could connect quickly, and the families who couldn't afford those things, and who was going to provide that. Job opportunities, when industries, particularly industries in the service industry, entertainment, restaurants, hotel, they were hit hard. And we know that a lot of people in those job sectors don't make a lot of money. So they went from not making a lot of money to zero money. That really hurt our families. And then access to healthcare. And I think we've all seen the struggles that families outside the metropolitan areas have had in getting their loved ones care, particularly with severe cases of COVID. So we really need to watch those in the future. But I think we already know that those disparities existed, and the pandemic did nothing but really illuminate those further. Okay, so we're going to look at some of these issues in kids count data. And what I want to talk about is when you see an absence of something like, hey, we're not ranked very poorly in this, that, and the other. I want you to recognize, because I hear people say this all the time, we've gotten better because our abuse and neglect rates have gone down, as an example. An absence of a negative does not equal a positive. And for every negative we're trying to reduce, we also need to actively intentionally work on creating positives. So just because you're not being physically harmed doesn't mean you're loved and nurtured, right? So we need to look at both sides of the coin. So be super critical when you look at the data and think about, just because that is in an okay place, or maybe it's in a really bad place, what do we want to do to really bolster the good? Because often the data we look at is really focused on the negative. So let's just talk about how in the world is Oklahoma ranked 45th out of the 50 states in child well-being, according to kids count data. We're going to walk through their large buckets. So economics, this is where we do the best. So we're ranked 33rd in economic well-being. Which kind of surprises a lot of us, because we know that we have high poverty rates in Oklahoma. We know we have kids that go to bed hungry at night. We also know that a lot of the jobs in Oklahoma are low paying jobs. So, and when you look at these numbers, and we have gotten better over the years, much like the rest of the country, but not any big, huge leaps and bounds. So that probably is why we're not moving from 33rd to 10th in a one big leap. But we were getting better. And these are from time periods 2010 to 2018. Education. Wow, we rank 48th out of 50th. We have a large number of children ages 3 to 4 that are not in pre-K activities, early childhood activities. It's something that is surprising, because we talk all the time about our leadership, our national leadership in early childhood work, which we are. We led the country in, thanks to Ramona Paul and others many, many years ago, in making sure that our kids could get into early childcare, and we do, or child learning situations. And we do have the opportunity for it to be universally provided. It's just that not everyone's taking advantage of it. In addition, here's where we get hurt. Our fourth graders not being proficient at reading. And when you get a chance, and I will send this fact sheet to you so that you have all the data, and then you can go on the Kids Count National Database and look at us compared to other states. We really struggle with education. And when you look at the states that don't, it's night and day. So when you consider that the country's average is 68% or 66% in 2018 for proficiency in fourth grade reading, and we're sitting in the 70s, that means we've got some states markedly better, right? If the average is at 60 some odd. So this is a struggle for us. And as you can see, it just continues as kids get older. And now we're looking at eighth graders in their math proficiency. Again, we're looking at 3/4 of our kids not at grade level. So these are worrisome. Oops, sorry. And one more, and that's not graduating on time. We don't look much different than the rest of the country, a little, but not a lot different. I'm not quite sure why it says our data is not available except for 2017 and 2018. I don't know what changed, but that's the only figure that Kids Count has provided for us, which is interesting too. Okay, here's another area that is worrisome for the state of Oklahoma, but again, not a surprise. Low birth weight babies. We don't look too much different than the country there, which is interesting. So this tells us right here that all of the gradations between states are pretty small. So if we're ranked that low and we're still sitting around the state average, we're looking at very small percentages that make those differences. I'll tell you where we struggle in Oklahoma as well as the rest of the country. If you sliced and diced low birth weight babies by race and ethnicity, you would see a very, very big difference, in particular with African-American babies. So we really need to concentrate our efforts on low birth weight and prenatal care around those populations if we want to see a big difference in low birth weight rates. In addition, children without health insurance. Another topic that might be good for this group someday would be to have someone come talk to us about the potential of managed care and the shifts that we're seeing in Oklahoma and what that could potentially impact our children. And then quickly, child and teen deaths, and that's for any kind of death, not anything in particular, not abuse or neglect or suicide, but all deaths. I want you to note how different Oklahoma looks there. Our kids are dying at a faster rate. Don't know why, and that'd be interesting to know. And next is obesity. And lately I've been hearing Secretary Kevin Corbett, he's our health secretary, talk about how he wants to tackle this particular issue in Oklahoma. So that might be another good topic. And then the last bucket, just quickly for us to go over, is family and community. So as you well know, we like to get divorced in Oklahoma. We have a high divorce rate, which means we often have a lot of single head of households in Oklahoma, but it's really not much different in the state from the different states around the country. So we look like we're in pretty good shape there. Families where the head of household lacks a high school diploma. Again, we look pretty much like the rest of the country. Children living in poverty. And then the teen birth rate is where we look very different. And while the rest of the country has cut their teen birth rate in half, we did too. It's just we started at a much higher number. So that's kind of interesting there. I want you to think about the indicators that are important for well-being that are not included. And I'm just going to throw out some examples that I thought about that I would really like to know. Infant mortality is almost always a good indicator for how well a community is doing, not even just family situations. I'm also interested in our child and teen suicide rates. Unfortunately, I don't think we rank well in that area, and I'd like to know more about that. Safe and stable housing is a big deal for our families, as well as livable wage issues, whether we're talking about minimum wages or families that have parents with multiple jobs and struggling to be involved in their children's lives. And then I think analyzing the data by geography, race, and ethnicity and income would be very telltale and tell us a lot about what's going on in Oklahoma. I also just want to throw in, this is really an Annette thought, but I think it's important. Every time we go over data like this, it's kind of disappointing, and maybe it fires you up, it fires me up, but I hope it does you as well and doesn't feel overwhelming. But what I recognize real quickly is we don't have all the partners at the table. And so much of this is tied to economics. We really need to talk about widening our circle of friends and partners. And that means people who provide and create livable wage kind of job situations. Not really interested in more burger flippers. We need livable wages, or we need to talk about what is the minimum wage and what should it be. More affordable, stable housing, quality, affordable childcare across the state. And I think one of the best things that nonprofits do for our state is emergency cash assistance to keep families from spiraling out of control. And with that, I'm going to turn it over to Joe. Joe's on, right? I haven't seen him, but I'm assuming he is on.
I don't know if I want to go now.
Yes, you do. Yes, you do. I just set it up to tell you, you're going to tell us how to fix all that.
Yeah. Well, the good news is the legislative session starts on Monday. Let's hear a round of cheers. I know we have two of our friends on the call, John Echols and Cyndi Munson, who do quite a bit of work to make sure that we are overcoming these issues. Both of them have been champions on the DDSD list, as well as other issues out there. There is so much that we've got to tackle. And let me see if I can pull up mine. Let's see. I don't know. I may just have to have somebody show mine if that's all right. And I can just talk over if we can just run through it real quick, as we only have about 6 minutes. Trying to do a screen share. There we go. Never mind. I got it. All right. So we held our fall forum in November and tried to go through some of the issues of what would be of the most importance, most interest to try and get passed through the legislature this year. As Annette said, we have so many different issues that need to be tackled, and we just have so little time and so little resources. And that's why Count Me In for Kids, other collaborative programs are so important. The work that OCCY does, working with the officials, putting the agency directors in with lay people to work on some of these topics within their agencies, with the work of the Trauma Informed Care Task Force. I know we have a bill filed this year that is going to try and codify some of the work of the task force, so it will be ready to go once the task force completes their work at the end of this year. One of the first issues that we talked about was modernization and technology usage for child advocates. We recognize that there is so much that needs to happen, and we don't expect this pandemic to be over with the snap of the fingers by the end of this year. I don't think we're going to see anything relating to normal before the middle of the year. And OICA is planning on doing all of our events virtual, maybe with a few people in person this year. It's just not safe right now. And with the vaccines being tested right now, thanks to the Lynn Institute for their work on what they're doing with the childhood vaccinations for COVID-19, we've got a long ways to go just to even get past this mess with COVID-19. We are working to try and promote more awareness of what is offered through the state agencies. The state administration is working on, originally it was a front porch initiative. It's expanded into the Be a Neighbor program. It's going to be coordinated quite a bit through DHS to raise awareness and the opportunity for individuals to receive benefits that they would qualify for by going to a one-stop shop. And so this is something that we've been working on. We've received a grant to help with this effort and try and make it easier for individuals to be able to seek those services that are available to them by going to one place, and hopefully eventually be the first in the nation where you can have something similar to TurboTax, where you enter your information in and it would automatically place you into application for all of the benefits under the state that would be available. They're spending CARES money to look at developing something like this, and we're working to make sure that the lawmakers understand the benefits from this, because it will save resources through the agency if you can have a one-size-fits-all application for all of these programs available. And we know we'll have to work some at the federal level to make sure some of those programs would be allowed to do that, but we're hoping we can lead the nation in this and make it easier. Going to the next slide, economic challenges facing Oklahoma families. Annette touched on this. Many of the problems that we're facing in the state go back to the resources that are available to families. So just like what we'd like to see for them to be able to qualify for those resources, we've got to make sure that we have that investment in place, make sure that all available federal funds are used. We saw what the state did with the vote with Medicaid expansion. We know the appetite is there, at least for a majority, even if it's a slim majority of the voters, to make sure that those resources are matched at the federal level and that all the dollars are brought back in. We'll touch on some of the federal side when we get down to the end of the discussion. But we want to make certain that the lawmakers understand this and that the agencies have the ability to get all matching dollars available for them. And if there is a new CARES bill that is passed, new funding that is passed, make sure we maximize those opportunities, not with one-time dollars, but prop up what we are doing, what we have going on, such as the home visitation and family resource centers, to make sure that those dollars carry forth and that mission can move ahead. Going to the next one, some of the issues of what we talked about with the Landlord Tenant Act, other issues with families. You can go through here and read some of these. I'm just trying to flip through. Student health and educational well-being was one of the topics that was discussed at Fall Forum. And if we want to become a top 10 state, we've got to make sure these students have healthy opportunities and that they have the educational opportunities available to them. We're working with Sherry Conley. She has a bill that's working on providing increased access for school counseling services. We're all well aware of the need for counseling services. I'm going to a counselor right now just to talk to somebody because some days the walls feel like they are just closing in. And I know more people feel that way these days with COVID-19. You can see the background, I'm working from home. That lack of social interaction we know is impacting these students. We want the kids to get back in school, but we want to make sure that they're getting back to school safely and that the teachers and the staff members have every opportunity in front of them to maintain that safety for themselves and for the kids around them. And healthcare and insurance improvements, as I discussed, we saw what passed with Medicaid expansion. And we know that there are going to be some changes going through with managed care, with what the Oklahoma Healthcare Authority is presenting. We know there will be some discussions at the Capitol about managed care. Whatever happens, we want to make sure that the best systems are in place for these kids. Make sure they have access to medical care, counseling, dental care, all of the necessary things that they need to thrive and be healthy as young people, and then as they move into adulthood, have greater opportunities in front of them. And this is going to be the long game. And no bill that's passed this session is going to make everything better. We're looking at generational issues, and we've just got to start focusing our efforts on doing what we can with preventative measures. Get ahead of the game. Let's not spend as much with dealing with the problem right in front of us. Let's focus on doing investment. I saw a stat one time where they say 5% of government funding goes to preventative measures. We've got to increase that expenditure and make sure that we have those opportunities available. So what's in store for 2021 for our children at the federal level? Well, I just want to bring back everyone's attention to our good Oklahoman Garth Brooks, what was the most talked about photo of the inauguration for one day. And then things changed. And we need to remember things change immediately. Government may run slowly, but attitudes change. And a lot of it is developed by advocacy. We're going to see some changes presented at the federal level. I've got a description here that Laura sent over to me about what the Biden plan is, so people will know more about what's being presented to Congress. Who knows if the $1.9 trillion will pass as is? I suspect it won't. I suspect with a 50-50 Senate, there's going to be a lot of haggling that will happen with that. But we have a golden opportunity to make sure that we play upon what has already happened at the federal level with benefiting kids. Working with the Up Chafee program, we saw some great additional opportunities that have been presented to the states, and we need to have a voice. OICA has gotten more engaged in federal opportunities probably since Ann was involved, with Ann's work with the Partnership for America's Children. And we're trying to continue that work, being an aggressive partner and trying to keep our federal delegation informed about issues. And there is an effort to create a White House Office of Children and Youth. And we're hoping that that will be created within the White House to advise the president about the issues with trauma and what is facing America's children. There is a description here about the other parts of the COVID, or about the COVID plan that President Biden has suggested. We'll leave that here. And I want to put in conclusion, be sure and go read this as it's emailed out to you. These are some wise words from Laura Boyd, who will be speaking next. I followed in Laura's footsteps in more ways than one at the Capitol, and she has been a treasure for Oklahoma. She, in fact, was the first person I spoke to when I got my job at OICA, other than asking Ann if I should do it. And Ann gave me all the pluses and minuses, and so did Laura. So both of them have been fantastic role models for me as I've moved up and grown up in this system. I want to thank everybody for that opportunity over the last 4 years, but these are some very wise words. Please look at those. And here is my contact information at the end of the slide. Please reach out to me if you have any questions about these, or if you see a bill going through the Capitol that impacts you and your agency or the kids that you serve, reach out to me and let me know so OICA can be your voice at the Capitol as well as the voice for Oklahoma's children.
Joe, I want to thank you for that presentation, Annette, for your presentation. I'm glad I didn't cut you off early, Joe. I didn't know that slide was coming up. So thank you both. I think I want to just summarize very quickly some themes I heard so that we can move into our presentation with our legislators. But I think what I heard you both emphasize that's unique and essential is that child protection, prevention of child abuse and neglect, those are not only child welfare issues, those are economic issues, those are social justice issues. And we do hear that you're telling us as leaders about that. We're hearing that at the federal level and at the state level as well. And it's incumbent upon us to deliver that to two sets of people, two groups. Those who advocate for us, like OICA and like the Commission on Children, and our legislators who are here. We're going to hear from them next. That's sometimes a big gap. How do we support you, Joe, Annette? How do we support our legislators and let them know? So we're going to be trying to do some work on getting that information to you and some suggestions on really getting that out. At this point, I'd like to introduce our two guests from the Oklahoma legislature. We have John Echols, who was elected to represent House District 90 in Oklahoma County in the House, and he was elected in 2012. He currently serves as the majority floor leader, and so we're so happy to have him and his ear and his experience with us today. He is a graduate of the University of Oklahoma and of OU University of Oklahoma City Law School. We also have Cyndi Munson. Cyndi is elected from House District 85, Oklahoma City, and she has been in the legislature since 2015. She's the first Asian American woman elected to the Oklahoma legislature. She's a graduate of UCO, and she received her Master's of Science in Leadership Education at the University of Nebraska in Lincoln. Cyndi, I'm going to ask, or Representative Munson, I'm going to ask you to go first, if you would, and make some of your comments. We want to allow you and Representative Echols to go back and forth however you wish. But obviously what we're interested in particularly knowing about is what's coming up in this legislative session that's going to particularly impact families and children.
Great, thank you, Laura. it's so good to see so many friends and neighbors and people that I've had the pleasure of working with since being elected, but also in my work with the Girl Scouts of Western Oklahoma. So thank you for your continued work and commitment to children and youth and their families in our state. It really means a lot to me personally, as well as professionally. I take a lot of what I experienced as a young girl and as a young woman into my work every single day, knowing how important it is to invest in our children and ultimately investing in our families. And really, really just appreciate the dialogue and the conversations we're having across the board in the legislature about childhood trauma, and specifically trying to address adverse childhood experiences here in our state. I was just on a panel like 15, 20, well, 30 minutes ago, I guess. I have been listening in on what you all have been discussing, but I was just with the Oklahoma Policy Institute and talking about the budget and what's coming up in the next session, and really highlighted, and something that I try to highlight in my work and when I do have the opportunity to talk about ACEs and on panels and different conversations like that, is to use the data and the statistics that we talk about that are often so dire in Oklahoma, to get beyond just the number and really remember and understand that those are lives that we're talking about. Those are lived experiences of our families. And when we talk about high incarceration rates and low health outcomes, that means that our neighbors are struggling. And that means that our families really need us to step up to the plate in our leadership roles and our positions of power to find ways to improve their lives. That's why most of us run for office, regardless of what side of the aisle we're on or what ultimately motivates us once we get into the work. We're all moved to make a difference for those in our community. And I don't know that there's anyone more important than our children. But I know that when we help our kids, we're helping our families. As Annette was going through her presentation, some of those statistics that were highlighted, those were things I lived through. I grew up in a single family home. My parents divorced when I was in 8th grade. I needed and am grateful that I had access to early childhood services when I was in elementary school, though I don't know that they looked exactly what they look like now. And I had access to school counselors who helped me process the trauma that I was experiencing as a child. And so many times when you hear about the work that I do and some of the things that I'll highlight today is a result of what I lived through myself and what I think that our children still need. And I think in the last decade or so, we have struggled really investing in those services and in those programs. The entire time that I have served in the legislature, in the beginning, was rough. I'm surprised I'm still here because of just the budget struggles that we faced and the revenue issues that we faced. And it was really hard coming to work every day and having families come to your office and tell you the critical services that they needed that were being cut could not just alter their lives, but take some of their lives. And so I certainly carry that with me every day. And with everything that we're experiencing now with COVID, it just makes it that much heavier because everything that we have struggled with in Oklahoma has only been exacerbated. And I know we've all personally been impacted in some way, shape, or form. But when you're in this work, you hear so many stories that it motivates you, but it can drag you down sometimes as well. But it keeps us focused. So I guess what I'll do here is maybe just kind of stop so Leader Echols can get a word in, because if you just let me keep going, I'll just keep going. But one thing I did want to highlight too is just, I think many of you know because we worked together, but I worked for the Girl Scouts of Western Oklahoma prior to running for office. My specific area of work was working with girls and families who were justice involved. Their mothers were incarcerated or some family member was incarcerated. And so worked together with the national organization and then sister organization, Girl Scouts of Eastern Oklahoma, and the Department of Justice of finding ways to prevent girls specifically to prevent them from being justice involved. And what I saw there was a real need for more investment in education and healthcare. And I love that it was brought up that the economic opportunities, that's really where it's rooted from. When our families, when the adults in their lives can make the living wage and they can provide those basic necessities, the future for our children are just so much brighter. And while I loved my work at the Girl Scouts, I liked writing grants and helping girls sell cookies and those types of things, I really felt the call to run for office, because I felt like those in the policy decision, at the policy decision tables, were that's where the change really needed to be made. And people like me needed to be in those rooms talking about these stories and sharing our own lived experience, and really trying to humanize the decisions that we were making. So I did want to highlight that that's a lot of where my passion comes from too, and the work that we all do together.
Well, I'll just kind of pick up from there. It's always an honor to talk with Representative Munson. It's one of the things I want to point out, and Representative, make sure I get this correct. You are the caucus chair for the House Democrats, correct?
That's correct. Forgot about that.
I want to point that out, and here's why I want to point that out. What you have on this call on the state level is something that unfortunately probably hasn't occurred in the national level for a decade, which is somebody in leadership in the Republican Party and somebody in leadership in the Democrat Party that really like each other and work a lot together. So I just don't have enough good things to say about Representative Munson. What we have been able to do together, from starting the bipartisan waiting list caucus, which we started before either one of us were in leadership, which was able to eventually more than double the amount of money that goes into the waiting list fund. And it has survived all of those budget cuts because of that, because we were working together. I think, I've started off like that for a reason. It is hard to talk about any political issue, whether it's on the Oklahoma level or the federal level, or any political issue. And right now, this obviously is a family issue, but we're talking about political solutions, without talking away for representatives and members of the legislature to model good behavior. And what I mean by model good behavior, I mean that ability to work together to find common solutions. At the end of the day, I've been blessed to be the majority floor leader in the Oklahoma House of Representatives for 4 years. That makes me the longest serving Republican majority floor leader in the history of the state. If I survive another 2 years, I will be the longest serving floor leader, Republican or Democrat, even pre or post, even pre-term limits that hadn't done it for this long. Part of that, what I can tell you in doing that, though, is it doesn't matter what I want. No matter how long I've been doing this, it doesn't matter. What matters is the coalitions that I can build. So I can have all the opinions in the world, and I can have all the desires, but if I can't build those coalitions and bring 51 members of the House and a majority of the Senate, then those desires are pointless. So I'm once I get past this, I'm going to get into some specifics of the legislative session. But what you guys are doing in this is just so important to the legislative process and the political process. Bringing that advocacy that says, here are the issues. I loved the first set of slides. I don't know if you saw, maybe the response that they were going to send them out was in response to me pulling out my camera and taking pictures of the slides, because I like some of that data so much, and I wanted to have it. Having people come together and say, here are the issues and how do we fix them? I mean, here are the issues, how do we come together? Because I've said on TV 100 times that frankly, we as Oklahomans rise or fall together. The legislature can't win and the governor lose. The House can't win and the Senate lose. And one of the things we found out is, honestly, in the state level, the minority party can't lose and the majority party win, or vice versa. Oklahomans are going to go up or they're going to go down. But when we had those 2 years of dysfunction, we saw kind of a unilateral, the citizens, and I think it's hopefully changed some things. The Republicans lost a whole lot of people in primaries 4 years ago. The Democrats lost a whole lot of people in generals 4 years ago. And I think it was a direct response to people want solutions, people want results. Now, the other thing I will tell you, we're not experts in everything. We're not. My background is as a lawyer and then in the healthcare field in business. I'm not an expert in early childhood issues or even in disability issues. I've become that because I've got great people like yourselves, great advocates that have educated me. I don't think Aaron Taylor is on this call, but I can't talk about my involvement in children issues and disability issues without talking about Aaron Taylor, who, by the way, is not a member of the same political party as me, but is somebody who took the time when I got elected to educate me and to work with me and say, you're my representative now. Let's figure out where we agree on issues, and let's figure out where we move forward together. Those are so important. I mean, those relationships are so important. What I think you're going to see, and then I'm going to open it up for questions and go to Representative Munson. I think what you're going to see, the focus on next legislative session, the budget is not going to be as bad. Man, it pains me to say this, though, because as soon as I say this, there will literally be about $5 billion worth of asks in a $7 billion budget. But the budget, truthfully, is not going to be as bad as it was. We did some things. Now, it can be a little deceptive. We have to pay for Medicaid expansion, which I've been very transparent, will pay for itself long-term. There is a cash flow problem that we're going to have to deal with. Long-term, it will pay for itself. Short-term, it's going to create a large cash infusion. We also have to reinvest into the teacher retirement fund. We borrowed some money from that, which is the first time legislature's done that in about 20 years to smooth over this dip. We're going to have to reinvest. We said we'd put the money back. We're going to, and we have to reinvest in the roads fund. So while the budget is nowhere near as bad as it looked like it's going to be, I don't want there to be this idea that there's a huge extra sum of money out there, because that's probably unrealistic. So what do we need to do? We need to do a better job prioritizing, and I love what Joe talked about, talking about prevention. And I think those are the discussions, if anybody's listened to any of the budget meetings, and if you had, may the Lord bless you. For the most part, they are as boring as can be, but it's really getting down into the weeds. But those are a lot of things you're hearing them talking about right now. I also think you're going to see a renewed focus from the Republicans and the Democrats, frankly, in educational outcomes. We've got to start talking about education in terms of helping fourth graders read and helping eighth graders do math. We've got to start, everything we talk about has to be with the child in mind. And if we do those things, it becomes real easy to reinvest in education, because then we talk about how do we best have a fourth grader read more? Well, the statistics clearly show number one is family issues, frankly, even before teachers. The number two is put a great teacher in front of a student. I mean, those are how we do these things, but it's a mind shift change. So we start actually holding ourselves as a state accountable. Everything we're doing, are we gearing towards raising those educational outcomes? Some of that affects higher ed. Representative Munson and I have done a whole lot towards Oklahoma's promise and continuing to protect that funding stream. It's a big deal in my district, especially with OCCC, continuing these educational opportunities. One of the things too, and then I'll leave you with this to take questions. One of the things that we got away a little bit from last year, it's hard to talk about last year without talking about kind of some of the fight between the legislature and the governor. His first year went really smooth and was a really good year. Kind of fell off the rails the first year, the second year, and I don't want to live through one of those years again. I've been very transparent to everybody that I've talked about. I serve in the legislature because I'm passionate about making the state of Oklahoma better. Maybe that's why my brand of politics is a little different than other people's. If you want somebody that's going to yell and scream and be mean to the other side, whether that's the governor, whether that's the minority party, don't vote for me. I'm just not your guy, because that's not what I'm up there to do. I have very conservative ideas, but I'm there to move the state forward. If we continue to be able to do that and to work together as a group, that's where I think you're going to see the push next legislative session. Yes, there's going to be areas of disagreement. And by the way, areas of disagreement, you can hear what I'm saying. Areas of disagreement in the political process are good. We want those. We want Representative Munson and I to stand up on the floor and argue vehemently over differing points of view. But then we want us to sit down and say, okay, when the votes come down, how do we move this state forward? And that's not just the R's and D's. That's House and Senate, that's rural, urban, and that's legislature, governor. And frankly, I would argue that and honestly, it's east-west too, the east side of the state and the west side of the state. We have all these different divides. I think you're going to see so how do we bring them together? You're going to see a renewed emphasis on how do we do prevention and how do we refocus in education on these outcome-based ideas. And when we recognize those distinctions, which frankly, in my mind and what I do, the RD distinction, Republican Democrat distinction, is probably the third worst distinction at the Capitol. I mean, it's down there from urban, rural, and frankly, east-west. From where the state comes from. And then you have kind of the RD divide. They've all got to find a way to work together, and none of them as bad as making sure the legislature and the governor find that fighting, but also find that common ground. So you just keep pushing us to hold us accountable to see results. And with that, I haven't looked at the chat function. I don't know how you want to handle questions, but you guys just let us know.
Leader, I'm going to moderate the questions. We have about 5 minutes. And I think that one of the things that we all would like to know is what are specific pieces of legislation that are focused on families and children that each of you are either championing or you're aware of, and therefore, you know, putting your interest and your reputations behind.
Well, this is Annette.
I'll go ahead and,
Oh, go ahead.
oh, I'm sorry. No, you
No,
go
no.
ahead, Annette.
Well,
No, wait,
Queen Annette
if I could.
Jacobi, you go.
Well, I will just say quickly that OCCY, while this is not a preventive focus, I think it is extraordinarily important. Last year, we ran some bills around detaining youth, particularly where they should go when they are arrested, particularly before arraignment, an adjudication. We don't want kids in county jails. County jails aren't equipped to take care of kids. They don't provide the services that a county youth detention center does. We need to get in compliance anyway with the federal law here in any day. And so we just need to see us treat youth like youth and not mini adults. They may have made a mini adult crime, but their brains aren't there. And we need to really, really fix that. And so I'm just going to throw that out there.
Representatives, are you authoring specific legislation towards focused towards family and children?
Well, I wanted to comment on what Annette said because it's in my notes right here. I was going to highlight Representative Lawson's bill. He and I have been working together on that. And last year I co-authored, and I'll join him on that again this session, and advocated for the bill with the Democratic members of the Children, Youth, and Family Services Committee. I serve on the state advisory group for the JJDPA Act, so making sure that we're in compliance with the federal law, and you know, that legislation is so important for children and families, especially when we talk about criminal justice reform and the work that we're doing there. But like Annette said, I think the best way to describe it is that children have to be treated like children. County jails are not equipped, and quite frankly, they don't want to have youth in their jails because it's a huge liability for them. But they don't have the resources to make sure that students or young people get access to their education requirements and nutrition and exercise. And the biggest thing is sight and sound. So there shouldn't be seeing or hearing adults who are incarcerated or who are in jail, because that's truly traumatizing for kiddos. And so that was a bill that I wanted to highlight. I will join Representative Lawson again in those efforts. Last year it passed in the House, if I remember correctly, Leader Echols, and then it went to the Senate, but COVID happened. So there's so many good bills that we worked on prior to everything shutting down and sort of readjusting our work. But for me, there are a couple things I did want to highlight. I'm running again the Handle with Care legislation that I ran last session that again passed through the House, but didn't make it to the Senate because we shut down. But that's really just, I will say I have run into issues about mandating Handle with Care, and I know better not to ever use those words. Or use that word in particular, but I have gotten pretty good support, especially from law enforcement and the folks who are in the public safety committee, though it could be, I think it's a new name. I'm still learning, Leader Echols, all the new committee names, but have found ways to work with those who haven't implemented that program. And I think we're all aware of what Handle with Care is, right? When a child, I'm looking at people to see, so I don't waste time talking or explaining what you already know, but hopefully we'll just have a statewide definition or protocol for those folks in other communities who aren't already implementing the program to do so. And then I'm working with the Office of Juvenile Affairs to update some of their staffing definitions and things like that to better serve youth. And I think overall, in terms of, I mean, the things that we have already been talking about, Medicaid expansion, ensuring that we're funding and implementing the program the way that the people have voted for us to do that, is going to be really key this session. I think that'll probably be the biggest conversation that we have over the next 4 months. And then there are bills to restore the earned income tax credit, though they aren't mine. They're other members in the House. And then there's conversation about increasing the minimum wage. And I think the best way to do that, I was asked this earlier, if Republicans would join Democrats because they hear Democrats talk about it so much, is to repeal that preemption law that doesn't allow cities and local governments to decide if they should raise minimum wage. I think there is a way for us as Republicans and Democrats to have that conversation and give that control back to our local communities. And then I put something down here because I need more information. We can talk about it in the chat, but I know that there's a bill for CASA, I believe, to improve some of the services. I don't know if Nikki is still here with us, but I did want to highlight that bill that was brought to my attention, just basically just updating some language around, I think it's with DHS. If we can get more details on that, I would be grateful. I would be happy to help those with CASA who are working with children and families to improve those services.
Thank you, Representative. Floor Leader, do you want to add some of your favorites?
Yeah, and we're running short on time, so I'm going to go fast. Yeah, the bill, the incarceration with juvenile bills is one of my favorites. We did pass it out of the House. That's one of those bills that you just got to find a way to get done. As Representative Munson said, there's no opposition to it. The Sheriff's Association is in favor of the bill. There's not a county facility that wants juveniles. This is a perfect example of having everybody come together and saying, all right, we all see a problem. Everyone agrees what we're doing is not the right thing to do. Representative Munson and Representative Lawson have been real heroes in pushing that. We passed it off the House floor last year. I'm in no way blaming the Senate. If you were talking to the Senate, they're going to tell you that a lot of great Senate bills died as a result of COVID. COVID last year was really rough, and we did not hear nearly as many bills. It's interesting. And then my major focus is going to be on the children's side, is going to be protecting the DDSD, the money we put towards the waiting list. As floor leader, I run the policy side of the House. Chairman Wallace runs the fiscal side of the House. But one of the great things of being floor leader is I always do get a couple asks in the budget that I want to make sure. And every year I've been there, I've used it to make sure the DDSD waiting list funds don't get cut. And that's going to be one of my asks again this year. Then we'll be shepherding through. I'm not as directly involved in a lot of legislation because I'm over all of it. You were joking about the committees, Representative Munson, tell me about it. I've spent the last 2 days assigning bills to all of those committees and had to create committees for all of those committees, put members on all of those committees. But I think the major push I will have is on the funding side, making sure those funds are protected and the reinvestments are put back in, and then continuing to shepherd those through. I guess the last thing to remember, when people complain every year, it's kind of funny. People complain every year about the number of bills filed every year. I don't care if we file 1,000 bills. I don't care if we file 50,000 bills. About 350 bills are going to get signed by the governor. I mean, that's just the number. That is what it is. That's the process as we go through. We're going to send between 600 and 700 bills from the House over to the Senate. They're going to send, far less than that back, no matter what those numbers are. So when we pick those, I guess the competition I've got to weed through is, as they say, separating the wheat from the chaff. As we have additional bills that are filed, we're going to try to make sure some of the ones that we're talking about. And you got some people on this bill, on this call, like Joe Dorman, that I lean on to tell me some of those important ones.
Thank you. Thank you very much. We can open the floor, or if you'll put your questions in the chat, I would be glad to receive those for the time that we have left. Let me start, you all folks might be doing that. Let me start with one question. How do we as a child advocacy community, how do we raise our voice at the Capitol when we feel so much less resourced than other constituencies, perhaps like um, banking, oil and gas, highways, healthcare. What do you suggest? And as you're thinking about that, you both talked about the importance of collaboration and the partnerships that sides could talk to each other. Is it possible that you might even find a work group, the two of you might start one this session for members talking about family well-being issues or focus as you're dealing with all of these bills, floor leader?
So yeah, I was hoping you'd let me hit that one first. So the first thing I'm going to hit on advocacy. Number one, know who your local rep and your local senator is. That is step number one. I'm amazed how many advocates that actually talk to me. I'll send an email and say, so who's your local representative, your local senator? And they don't know. Or if you don't know, develop a relationship with them. And you might say, well, I disagree with them on these five major issues. Now, remember when I told you that I serve because I care about this state. So if you're offended at this statement, I guess I'll tell you to get over it. I don't care. Like, I don't care if you don't agree with them on several major issues. You may find the issues that you do agree with them on and create an advocate out of them. I mean, you need to try to develop those local relationships. So I can't stress enough. You have more power as leadership. As long as I've been, you have more power over your member than I do. I can't vote for them. I'm guaranteed I live in my district, not theirs. Step number two, stuff like this, where you invite people in, get involved in the various groups on here. And I guess step number three, I love the idea of so Representative Munson and I have already created one for the disability community. I love the idea of creating, there's a bipartisan group dealing with mental health issues that's been created to really work together, that's done a great job. I love the idea of kind of a children's and families issue where everybody leaves their partisan hat at the door and decides we're not going to attack each other. We're going to find a way to move forward. I'm an old man when it comes to legislative service. I don't know that I'm the guy to do it. I've got 4 years left before term limits, and we'll see if my family lets me run again after this term. I jokingly say I sign up for 2-year contracts and that's it. But I would absolutely help finding some of our really good superstars. I mean, I think the benefit of the waiting list caucus, Representative Munson, is we were so young in our legislative service when we started it. And that's why I think it will outlive us. I love your idea, and I'll call you Representative Boyd, who was there long before us. I love your idea, and I think we can find a way to get that done.
Thank you. Representative Munson?
One thing I want to say is I'm glad he brought up Representative Boyd. No offense to Representative Dorman, but I did have Representative Boyd's yard sign. Well, I had one of your signs too, but when she was running for governor, when I was in high school, it was like stuffed away in my closet. I was like, I'm hanging on to this woman's yard sign. So that gives you a little insight into, I was always interested in this work, I guess. But a couple things I wanted to highlight. One, yes, there are lobbyists for all different industries, and they certainly have contact with us and opportunities to meet and budgets to have dinner and lunch and coffee and drinks and all those things. That's not something that I don't think any of us are surprised by. But the thing that moves me the most, and while I appreciate the work of those who are on the ground lobbying for the issues that are important to them, are the personal letters and the personal communications I get from constituents. Whether they're emails or actual handwritten letters or typed letters or phone calls, that reminds me that I'm doing human work. And so I think the power that you all have is you have communities that you're working with. You have, and I also get it that many of the families that you all are working with are already, their capacity is met. They're working, they're raising kids, they're figuring out navigating services and things like that. But if there is a chance to sit one or two or a handful of them down to write down their lived experience to their member, and I think individual letters are better than mass emails and mass communications. Like Leader Echols said, it's important for people to really know who their local elected leaders are, and it empowers them to get involved in the process too. And so I think that's a really important aspect to the work that you all do. And I think it's really powerful to engage those that you're serving to get involved in the process that way. And don't be intimidated or comparing yourself to these other industries that, you know, seems like they're more high power and all of that. I think that, you know, when children send me notes, don't exploit children, but if they have something to say, they need to say it, you know? And so I have notes hanging in my house and in my office to remind me that children are watching and they have ideas and they have solutions too. The other thing I wanted to highlight is in terms of the bipartisan caucus, the Potts Family Foundation has done a really good job of bringing together members of both parties and both chambers through the Early Childhood Education Caucus. And while we do talk about early childhood issues, we end up talking about family issues. We've had discussions about healthcare and minimum wage or the living wage. And we talk about so many issues that we have already brought up here. And to Leader Echols' point, we drop the party and what chamber we're in, and we really talk about the things that we're passionate about and what we're seeing in our communities. And hearing from experts has been really great to just better understand the policy issues that we're talking about and to try and take away the partisan aspect of it all, even though that is always going to play a part in the work that we do. But in those groups, in that caucus, we have even spent time in our meetings for folks to highlight the bills that they're working on. And we will end up co-authoring each other's bills, or we'll support each other's bills. And so there are opportunities that are already happening. I think just what we experienced last year kept us from being focused on it.
For both of you. We are out of time. And so I want to thank very much all four of our special guests, Joe Dorman and Annette Jacobi. We will send you PowerPoints. We want to thank you, Floor Leader Echols and Representative Munson, for your time and your energy. And we will continue talking. And I think one of the things I'll just close on, Floor Leader, especially, is something I learned in the early days, and it means a lot to me, and I know you guys still same way, that our budget is a moral statement. And we know that you'll keep that in mind as you move forward this year. Please call on any of us at any time. Thank you all so much for being here, and we will see you again March 9th at the same time, same place, same location. Thanks, everyone. Have a good day.